Hello, everyone. Dear friends, it is an honor to be here among all of you fighting for justice, decency, and protecting the most vulnerable among us. If we did not know it before, COVID has shown us that we are all in this life together from beginning to end. I am a former LA County public health nurse and the current director of Medicare-for-All Los Angeles, an all-volunteer organization promoting single-payer universal health care reform. Decades ago, when I was a hospital med-surgical nurse, I became disheartened, horrified, and then enraged to see terminally ill patients given a variety of treatments and surgeries that did nothing to ease their pain but made money for the doctors and the hospitals. Wow. The term flippantly used for these patients is that they were rent cases. They were there to generate the maximum income for the institution. Pacifica is using families as rent cases. My outreach has continued over the years at every turn in confronting the injustice and the cruelty of our current insurance system that uses our bodies as profit centers for a business plan. A system that treats some lives as worth more than others. It produces callous companies like Pacifica. The dire situation at the Pacifica residences is unethical, it is immoral, and it is inhuman. Moving seniors into a life-threatening, deadly COVID-ridden facility is criminally negligent. The high infection and death rates proves that Pacifica Companies should not be given COVID patient reception facility status, nor should Pacifica be given any authority over people's lives. I'm asking you, do corporations have a conscience?
No.
No. Do corporations, are corporations moral?
No.
Do they have ethics?
No.
No, what they have is an actuarial balance sheet and a bank account that we fill. Tragically, sacrificing lives for profit is how our deeply dysfunctional health insurance system works. Now notice, I did not say health care system, because care has been stripped away in the decades that I have been involved in it. Insurance is a business extracting money away from our care for their profit. What is not spent on our care is taken for profit. The past 2 decades have seen a rapid increase in private equity investment firms like Pacifica buying up healthcare facilities and services supported by government subsidies. Despite taking public funding, the control remains with a private business that makes money by charging us the most and giving us the least, and finding ways to avoid providing the necessary care. Private equity nursing homes skimp on services. They produce worse care. They increase mortality. They give less choice and are less accountable. They minimize staffing. They violate Medicare standards of care, and they are less responsive to cultural, nutritional, and linguistic needs. And they increase their operating costs to extract profits. This does not happen in other countries, as Mr. Montes says about Cuba. This does not happen in other countries with single-payer healthcare systems. The U.S. alone has a privatized system that treats our population as human capital. We are called IGUs in the insurance language. We are income generating units, not human beings. We alone in the United States have a for-profit system that enriches and empowers companies like Pacifica. At the beginning of this day, David asked if Pacifica can be likened to street violence, to the occasional random thuggish street violence. What do you think? Yes, they are worse, because corporations like Pacifica are taking thousands of lives. People should not have to fight for the care that we need, or worry about keeping our loved ones safe. We've heard from so many people here terrified about keeping their loved ones safe. In times of urgent need, we want to help our families come together, not to be torn apart with fear and debt, insecurity, and lack of options. The endangerment of this generation that has sacrificed so much and suffered so much and contributed so much is an outrage. We must save our seniors' lives in this moment, but we must also plan for the future by transforming our health insurance system into a health care system. Put the care back into the health system. If we do not reform this system now, our children and our grandchildren will continue to be faced with loved ones being shuffled around, neglected, disrespected, and mistreated. And those people are going to be me, David, and a lot of people here if we don't change things now. So beyond this moment of crisis, we must enact bold reforms so that the health and the well-being of each of us becomes the reason that we have a health care system. A new bill, Assembly Bill 1400 from California Nurses Association, is the reform that provides what we need. AB 1400 guarantees comprehensive care, not only in our elder years, but throughout our entire lives. Please learn about this reform and let your representatives know that you support replacing corporate profits with guaranteed care. Our healthcare dollars must be spent on our healthcare. Reform is only going to happen if we demand it. Today in this emergency, we must fight to protect and defend our seniors here at Kei-Ai and the Sakura IC facility. They and their families deserve to be treated with dignity, respect, cultural sensitivity, and loving care. These broken promises, outrageous evictions, dangerous transfers, and high rates of infection and death must be stopped now. So thank you all for being here as defenders of our treasured elders and as champions of humanity and decency. We fight because healthcare is a human right, all lives are equal, and all means all. Thank you very much.